Hello, everyone. Welcome. I'm Angela Chen, co-founder and CEO at Escolabs. Welcome to the third installment of the Escolabs Demo Day for our Cohort 6 Data Science Fellows. Today's theme is the future of COVID-19 solutions with data. Let me give you a quick introduction first, if you might not know Escolabs, and also share with you how the event will go today. So Escolabs is a data upskilling school based in the Philippines. And our mission is to democratize the future of work through data skills and education. Today's event is a part of a series of demo days which will showcase the work of our data science fellows who completed a 12-week part-time program to launch their careers in data science. And the fellowship is not just about skills building. It's also a community that's curious about how to use data to advance innovation and impact together. So many of our fellows will go on to work in the industry. And in fact, through new interview guarantee partnerships we've introduced this year, fellows can choose to have guaranteed interviews at innovative companies like Quadex, Home Credit, Kumu, and more. But before they arrive at that future, they're going back to one of the reasons why they wanted to learn data in the first place, which is to build a world that works. The demo day, this cohort is inspired by cult classic Back to the Future, where we'll envision how data can become a big part of our future lives through innovation in the startup ecosystem, through better governance and policy, and contributions to COVID and climate change solutions, all through projects which provides us a unique Philippines context. Today, we've invited Albert Yumol, or as he's known to us, Bash, as our representative from the Escolabs education team to introduce the projects and moderate the live Q&A. Now let me turn it over to Bash.
Hey guys. Hi guys, how are you? So my name is Bash and I'm a data scientist, ex-activist working on data problems for social good and social impact. I am also one of the instructors for this cohort in our data science bootcamp at Escolabs, where I taught data mining and natural language processing. As we know, we are still stuck in the pandemic right now. There's so many XCQs or community quarantines that we went through. We might be experiencing collective trauma right now, but the silver lining is that technology is a transformative tool that we can use to help us with our problems. We now realize that it is really important to have capacities to be data driven. Decisions that are critical to the lives of many people should be backed by science and evidence. So for the third day of our demo days, we have two projects that we did to aid the pandemic. Our first project is from Tim, Mikey, Famela, and Kay as they build a chatbot and answers our COVID-related questions. Let's welcome them. Take it away, guys.
Hello, we are Tim, Kay, Mikey, and Fem, and we will be presenting our capstone project entitled Talking Back, Answering Metro Manila's COVID-19 Vaccine Questions. 2020 will go down in our modern history as the year of the COVID-19 pandemic. This infectious respiratory disease has disrupted the daily lives of billions of people around the world. The first case of COVID-19 in the Philippines was identified on January 30, 2020, and eventually spread throughout the country, prompting the government to impose lockdowns or community quarantines to limit the spread of the virus. In order for our daily lives to get back to normal, we have to reach herd immunity. But what is herd immunity? Herd immunity occurs when a large portion of a community, the herd, becomes immune to a disease, making the spread from person to person unlikely. It is vital because herd immunity protects the whole community and not just those who are immune. Moreover, the more contagious a disease is, the greater the proportion of the population that needs to be immune to it to stop the spread. For example, measles is a highly contagious illness. It's estimated that 94% of the population must be immune to interrupt the chain of transmission. How do we achieve herd immunity for COVID-19? There are two paths: vaccines and natural infection. Vaccines are the ideal approach because they create immunity without causing illness or resulting complications. Using the concept of herd immunity, vaccines have successfully controlled deadly contagious diseases such as smallpox, polio, and many others. As to the natural infection, for COVID-19, even though majority are asymptomatic or with mild symptoms, some develop complications and turn into severe symptoms, which could be deadly. In this project, we explore what are the sentiments of the people on COVID-19 vaccination through sentiment analysis, what are the main concerns on COVID-19 vaccination through topic modeling, and how do we address people's concerns, questions on COVID-19 vaccination through building a question answering bot. Fam will explain to us how we gathered and processed the data.
Thanks, Tim. To start off our project, we chose Twitter to be our data source, and we scraped it using Asana Scrape. The scope of our scraping is within Metro Manila and within the time frame of December 2020 to March 2021, using the keywords below. We limited our scraping within Metro Manila to be able to translate these tweets later on. The total tweets we got were almost 30,000 with a little more than 3,000 unique tweets. And to ensure the quality of the insights from our models, we meticulously checked the tweets and removed unrelated tweets, such as those mentioning a different kind of vaccine like flu or anti-rabies, using as in replacement of the word as, those that use a different dialect that cannot be translated by Google Translate, and those that mention the vaccine brand name but are actually a totally different thing, like a fashion store with the name Moderna. After that, we translated the tweets containing the Filipino language using Google Translate API, but there were still tweets that Google wasn't able to translate, so we manually translated them. We then proceeded to transform this data set into a format that the model requires. For how this data is used to tackle a problem statement, here's Tim.
We answered the question, what are the sentiments of the people on COVID-19 vaccination through sentiment analysis? With the clean and formatted data, we computed the weights of each tweet to adjust the impact, 1 for the original tweet and 0.5 for the retweets. Then we generated positivity and subjectivity scores using TextBlob to get the result. As we can see by this pie chart, almost half of the sentiments on Twitter were positive. We also included sample tweets based on the generated sentiments. For example, a tweet tagged as positive is, "Not a COVID-free Christmas, but at least vaccines are already around the corner." Next, Mikey will explain to us how we approach our question.
All right. Thanks, Tim. Tim discussed how Metro Manila users felt towards vaccine and vaccination. So having an idea of how they feel, we now want to be more specific. This leads us to our second question. What are the main concerns around COVID-19 vaccination? This part uses topic modeling. In a nutshell, topic modeling uses statistical models to group tweets together. We then try to identify the topics discussed by each group of tweets. To identify these topics, we look at two things: the words associated with each group of tweets and the tweets that are most representative of each group. The topics shown here represent the concerns and thoughts on the vaccination and vaccines in the country. The topics are largely about the logistics, the procurement, and the efficacy of the vaccine. For example, 12% of the tweets talk about the FDA approval of vaccines, while another 11% talk about the start of the vaccine rollout. So to assist in providing answers to these concerns, we proceed to the third and last question to be explained by Kay.
Thanks, Mikey. So our final question then is, how do we address people's main questions or concerns on COVID-19 vaccination as identified using topic modeling? We decided to create a chatbot, which is a concrete, useful, and highly relevant product, which addresses the identified concerns on COVID vaccines. We have created a question answering bot by training it on various question and answer pairs on general COVID-19 vaccine queries. So once the user inputs a question, the bot then matches the input question with the questions in the training dataset. It then gets the answer to the question closest to the input, which it then returns as an output. So finally, we would like to introduce you to our COVID-19 vaccine chatbot called Talking Vac. Talking Vac is best used for quickly accessing generally verified information about COVID-19 and COVID-19 vaccination, taking in a wide variety of frequently asked question and answer pairs from various reputable web sources such as DOH, PSMID, WHO, and CDC. We have created two types of chatbots, one using Chatterbot and the other using BRIT, to be able to leverage on the accuracy levels of both approaches. So we will be guiding you through our Streamlit app and first demonstrate the chatbot we have created using Chatterbot. So upon opening the chatbot, the user can select between two options: questions on COVID-19 and questions on COVID-19 vaccines. So if we select questions on COVID-19 vaccines and type in the question, what vaccines are available? The bot will return the following response. So the available vaccines in the Philippines are Sinovac and AstraZeneca. Further, to aid in the improvement of the chatbot response during the testing phase and prior to the official deployment of our chatbot, we have included a feature wherein the user can input the correct response to the question in the case that the bot does not fully recognize the question asked. However, upon official deployment of the chatbot, we will remove this functionality to preserve the integrity of the dataset. And suppose that the chatbot does not output a reasonable response to the question, we have also included an additional feature in the chatbot, which provides 5 recommended questions based on the user input. So for example, if we select the question, are vaccines already available in the Philippines? It would return the corresponding answer to the question. So that is all for Chatterbot. Our second chatbot using BERT will be demonstrated by them.
Thanks, Kay. As Kay mentioned, this version uses BERT model. BERT stands for Bidirectional Encoder Representations from Transformers. It is a transformer-based machine learning technique for natural language programming pre-training developed by Google. So if we're going to input the same question that Kay asked earlier, the model takes that in and matches it with the closest question from the dataset, and it will return an answer, which is an extracted form of the longer version of the answer. We also included the link here in case you want to check or verify the information, and to also inform you when our dataset was last updated. In its current form, Talking Vac can answer frequently asked questions about COVID-19 vaccines and vaccination in the Philippines, as well as general guidelines in vaccination, like how to get vaccinated and the things to do before and after vaccination. However, Talking Vac cannot tell you real-time COVID-19 statistics, specific, personalized, and/or localized information, and to talk to you in Filipino. But these are the things that can be a starting point for improvement for Talking Vac's succeeding versions. That's the end of our presentation. Thank you very much for listening.
Amazing work, guys. Good use of your newfound data skills. This project is very relevant since we hear a lot of news about vaccine hesitance in our country, right? We do have some questions here from our audience, so we would really appreciate if you can answer those for us. First question that we have here is that how do you measure the performance of your chatbot? And if you can measure this, what metric can you use to quantify it?
Hello. Uh, answer the question. So, for example, for our chatterbox, our chatterbot, we have an option where you could input the correct answer. So, which we asked a lot of our friends and relatives of questions regarding COVID-19 vaccines that they may have, because of course everybody has a different way of asking the same question. So we wanted different people to ask the same question in a different way. And I think our goal for the success metric is the higher the accuracy of the questions answered by the people we ask the COVID-19 vaccination question is, the better the performance of our chat box.
Agree. That's a good way to do it, to include a feedback loop to your system so you can correct it. And it's a nice way to do human-centered design as well, right? You get input from actual humans and comment on the performance of your models. That's very great. Thank you, Tim, for answering that. Main question for me would be, this question is for me. Who is the main target for your project?
So yeah, I'll answer this one. So a lot of the vaccination process now are online. So we see like for Quezon City or Las Piñas, you have to go to an online portal. So there's an increasing use of online technologies to access the vaccines. So we're thinking that a good use case might be to integrate a chatbot to these online portals where you already have people signing up for vaccines, and in the same website, in the same portal, they can actually access a chatbot to instantly answer their general questions. So I think we this chatbot can be used as a supplement to existing vaccination online portals by the government.
All right. Thank you for answering that, Mikey. But my main concern is that since you've mentioned that this would be for the use of like the general masses, one observation that I have coming from a science background in the Philippines is that the Philippines has no history of science. We're very superstitious people, right? A lot of the things that we do is not yet evidence based. And I think one of the main problems is science communication, right? Um, how do you feel about the answers that your chatbot gives? Is it too like technical that ordinary people cannot really like digest? And if you feel that way, how do you plan to maybe package the answers of the chatbot to be more relatable, for example, to Juan de la Cruz, who doesn't have a science background or who cannot even speak English? So how do you plan to change and make the answers of your chatbot more communicable to the masses in the Philippines?
I'll go time.
Oh,
Good answer.
okay, so um, Chatterbot has a really good talk to, or parang it can mimic how people converse. So I guess having Chatterbot as an interface between people and birth model would be a good starting point to improve our current chatbot. And currently, our answers are directly derived from the websites themselves. So if they are too technical, which I think they are, um, it still has to be written by people who know, or rewritten in a more casual manner by people who know about the subject, because if we will rewrite it, we might not be able to accurately um, repackage the the information. So working with other with people or professionals from other field would be field related to COVID vaccination would be really good.
Also, to add to Fem's answer, so probably one of the major hindrances in our chat box is that the language that we use is English, because in Python, the libraries that we have are in English. And in fact, we had to translate some of the tweets that were on Twitter. So if we find a way to properly translate the information that we have from the DOH website, from the WHO website in Filipino before we answer the question, then that would also be accessible to the Filipino masses.
Okay. Thank you for those answers. I think it answered those questions um, correctly. My question, another question from me, while we're waiting for other questions, you considered two models, right? And those are very technical and very state of the art. I congratulate you that you're able to study it in just like a compressed time period. So why did you choose BERT and Chatterbot? And like, what are the advantages of both of the models? And if you recommend to productionizing your chatbot, which will you choose?
Well, for Chatterbot, I guess it's not technically used usually for question and answer purposes. So it is more of a conversational type of chatbot. So um, personally, I believe that the BERT model would be more accurate compared to Chatterbot, since this is also used by Google search engine. So definitely a more developed model. And in addition to that, we are also supplementing the BERT with the squad dataset, which contains a list of articles, list of question and answer pairs that can be derived from the article. So um, if we were to productionize this chatbot, then I believe that BERT would be a better option. But then um, there are also advantages to Chatterbot, as mentioned by Fem earlier, wherein it's a more conversational type of chatbot. So you can um, develop the chatbot to be more human or something like that. So yeah, BERT would be technically more accurate, but Chatterbot also has its advantages as well.
Great, great. I
Yeah,
agree.
I echo Kay. Oh,
Okay.
sorry. I echo Kay's sentiment regarding Chatterbot and BERT. That's why um, um, I said earlier that it's really, if it's gonna be productionized, and ideally a chatbot is deployed in very accessible messaging apps like Messenger or Telegram. So Chatterbot will be a good interface between the users and the BERT model.
Okay. This is very really like interesting for me because we are having a lot of vaccine rollouts now, right? And we really need to encourage more people to be vaccinated. So how do you plan to scale this? For example, if we productionize this, who are you like planning to reach out? Because I really do want this to like materialize because I see the potential of helping our kababayans. So what are your next steps for this project if you plan to proceed?
Maybe actually we have to also give credit to DOH. When you were looking through their website, they had a lot of communication materials specifically made for educators and other science communicators. So they had like a Google Drive containing different types of materials. So maybe we could reach out to them and maybe ask how can we even make this accessible to even more people.
Great, great. And I'm really like excited how you plan to pursue this project, even outside SQ Labs. Um, right, I think we don't have any questions from the audience, and we have to proceed with our next project. Good job, Group One, talking back for that very um, applicable project. Hope it materialize soon. As we know, as I mentioned a while ago, we have reached 1 million vaccines administered this week already based from news from DOH, based from news from agencies. But a majority of Filipinos are yet to receive their jabs, right? So to give light on the objective approach of vaccine rollout, here is our second project from GR on senior citizens COVID-19 vaccination distribution prioritization using machine learning. Take it away, GR.
Good afternoon. I'm Dr. Generoso Roberto, and today I'll be talking about COVID-19 vaccine distribution prioritization for senior citizens here in the Philippines. Now, as we heard from the news, time and time again, the COVID-19 daily, the record for the COVID-19 um, daily infection rates is constantly being broken these past few days. It is indeed that COVID-19 is very prevalent here in the Philippines, and the cases are still going higher and higher. Now, as the number of people being infected increase, there is a higher chance that some people will develop severe forms of it, which could lead into hospitalizations and eventually death, and sometimes death. And one sector of the community that are more at risk for these kinds of events are the senior citizens. It has been proven and it's been recognized by the different health organizations worldwide that indeed they are at a higher risk, and by their preventing the infection to this age group, we could lower down the mortality rate of this disease. And to and as a response, our government has organized and rolled out massive immunization campaign in order to vaccinate 70 million people here in the Philippines to achieve herd immunity so that COVID-19 could no longer become a threat. And as of now, at this stage of the vaccine rollout, the senior citizens are now the next in line. Unfortunately, a problem that arose is the lack of vaccine supply. All around the world, countries are struggling to get the necessary amount of vaccines for their constituents. And in this backdrop of limited vaccine supply, there is really a need for us to prioritize which areas this vaccine should be given to, so that in order to generate the most protection as well as to prevent unnecessary morbidities or death. Now, in order for me to accomplish this, I followed this methodology. First and foremost, I've collected data from the different agencies or organizations. I check those data, I look for duplicates or missing values. Then I feature engineer or I computed for the different rates per municipality. Then I look into the data, explore any possible insights, and eventually I've used these indicators to create a clustering algorithm using k-means. So k-means is a machine learning methodology wherein you would find the nearest neighbors or those that municipalities that have similar values to one another, similar attributes. So I look into four main factors that I believe could have an effect in the possible increase in COVID-19 cases, as well as possible increase in the severity of the case. So first, the COVID-19 data, which I get from the DH data drop. For this study, I only included up till March 24, 2021. Next would be the population data. So how many people are there in the municipality or how population dense it is. Since has more people living in a close quarters could help spread the disease. Next would be access to healthcare. I look into the health facility bed, which include both infirmaries and hospitals, to determine the access to inpatient care in the different municipalities. Next would be poverty, since as we all know, being poor poses a hindrance in accessing health services as well as they have poorer health health data. Now, when we look into the different into the data, we could see that indeed COVID-19 is prevalent. Only 18 out of the 1,647 municipalities and cities here in the Philippines have no recorded COVID cases. As of now, 80% of all municipalities in the Philippines have new cases, but these varied the incidence varies widely from one municipality to another, from each in others just zero point 0.7 per 100,000, while on the others it's reaching 10,000. Now, in terms of access to healthcare, we see that 50% of all municipalities had no inpatient health facility, and 8 out of 10 municipalities only allocate around less than one bed per 1,000 population. Then we do the clustering, and with the K-means clustering, I developed four clusters. Cluster 1 is the smallest with 22 municipalities, followed by Cluster 2 with 186, next with 519, and lastly Cluster 4 with 920. So looking into the different Cluster 1 I would call metropolis-like. This is because they have the highest population compared to the other cluster groups. They also have the lowest poverty incidence. They have, on the average, more bed per population ratio, but they also have the highest cases of COVID-19. So this is our priority municipalities to be vaccinated. And examples of these are the cities here in Metro Manila. Our cluster 2 is what I call city-like. They don't have, they have a high population density, but not as high as those in cluster 1. They have also high bed capacity and low poverty rates, but not so much as that of cluster 1. And also they have more COVID cases, but not so much as cluster 1. So for these, they are city-like since they are smaller than the metropolitan, but they are also our second priority for our vaccine rollout. Examples of this are the cities. As we could look here, the lighter gray are the cities in Negros Occidental. For our third cluster, these are the semi-urban. They have low COVID-19 cases comparatively, so they are not. We would not prioritize them in terms of vaccination, but we should also ensure that disease surveillance and disease prevention is still in place in these municipalities. Examples of these are the municipalities in Zambales. And lastly, we have the fourth cluster, which I call the rural-like. Rural because they have low population, they have low population density, and also they have low COVID cases since the area is large compared to the population. They're not the priority in terms of vaccination, but they need health support in their health system. This is because these are the municipalities that are resource poor. Like what we can see, they have high rates of poverty incidence, and also they have the lowest bed to population ratio. So indeed, they need help in terms of the ensuring that uh, health services are being provided. Now, from the municipality, we go to the region. And at the regional level, we could see that each region has different mix of these different clusters. So therefore, the regional strategy should be tailor fitted to the needs of its constituents. Take for example NCR and Region 3, since they have high high numbers of priority municipalities, they should be the first one to be given the vaccine to be prioritized. And in conclusion, there are a lot of data being generated by the different agencies. Machine learning, such as k-means clustering, could be utilized to use the different data, health and socioeconomic data of the different municipalities to come up with stratification that could be essential in the planning for COVID-19 rollout and other services. Thank you very much.
All right. Amazing work, GR. This project is very timely. Yeah, we do have some questions from our audience. First question that we have here is, how similar is your model to what the government is currently doing?
Currently, the government is based from the news that I have gathered. Currently, they are focusing in the Metro Manila area. We can see in the news that some LGUs in the Metro Manila area has started in their vaccination of senior citizens. So this coincides with the cluster that I've made, wherein the priority is really these metropolitan areas. Mhm. So in terms of for the farther out, for second, third, and fourth priority, it still remains to be determined on how the government will allocate these vaccines.
Okay, great, great. And you mentioned a while ago that part of the features or data set that you used for your modeling is the COVID-19 data drop. How correct is it? Or have you tried any like methods to like quantify the correctness of that data set?
Well, in I what I've got is the DOH data drop. Actually, I've limited my analysis to up till March 17 or 24, I think. But in essence, I only got the time frame wherein DOH has indicated that they have a higher degree of certainty that they already validated it. Unfortunately, even if these are the data sets that are already validated, out of around, there's still several thousands wherein there's still missing data. So uh, in some cases, our we can no longer remedy it, since these are the cases that were entered a year ago, or so. So it is really a long time ago when these data sets were already entered, and we can no longer validate that far back, maybe.
I
There's
see. Yeah. And if you can you like recommend I'm not sure if anyone from the DOH is listening, or you maybe know someone working there. What would be your recommendation in terms of, since you have access to the data and you have wrangled it, like dirtied your hands in it, like what is your recommendation regarding the data drop? What can be improved in terms of how they put their data, how they collect their data? So what's your recommendation?
um Actually, in terms of the data, since one of my current project before recently finished project was to assess uh, data systems of COVID, regarding COVID-19 of certain municipalities and provinces. And during the course of the project, we could see several possible weak links because in terms of, for example, collection of data, there are several data sources that and so there could be possible differences in data. For example, the region says that the case in this municipalities and so, but that doesn't uh, equate to those that the data coming from the municipality. So there's room for improvement in our processes to really quickly validate these 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 cases, and also in terms of the use of, for example, technology. We have provinces or municipalities that in order to validate if that their data, they need to call manually the different municipalities to make sure that the what was written is correct or not. So there are a lot of room for errors, or maybe in transferring from one platform to another. So that could also be room for error. So we could, in order to strengthen, we could really look down to find out where are the possible causes of misinformation or parang duplication or whatnot, and really strengthen the whole pathway from the very bottom to the very top.
Agree. I love that grassroots approach in terms of taking accountability and responsibility for the data. And again, it entails a lot of like discipline and even data literacy. So I think it's a lot of work, but it's a good thing that we're starting it right now. Um, I think if I can also like recommend, if we can also establish the systems ourselves as technologists and data scientists, for example, um, I'm not sure if you encountered this before, but if you put like a wrong input, for example, you have a password and then it's not correct, the system will not let you log it in. So I think it can be like similar. If the system feels that it's an anomaly, then you won't be allowed to input that kind of data. So you ensure the quality from the get go, from the input side itself. We do have another question, GR, a very interesting topic from the audience. Um, can you re-highlight this? I'm not sure if you have mentioned this a while ago. Why is the focus only for senior citizens and not the entire population for your model?
First, I want to narrow down the our study population, and I specifically choose the senior citizen because, what, first and foremost, they are the proven group of population that are most at risk for having severe forms of uh, this COVID-19. And also it has been modeled that by preventing the infection to this population, that it could vastly decrease the mortality rate of this disease. So that's why I focused on uh, senior citizen. And also this is the it is the next group of people that is the priority of our government.
Okay, great, great. Yeah, one more question from the audience. Let me just read it for you. Uh, Question goes, do you think the current spike in cases would affect the model made? Since over the past like weeks, right, we see like 15,000 cases per day. Oh no, oh no. So do you think that like spike in terms of the number of cases would affect the model?
Well, in terms of, I've used two indicators. First is the more short term, and also the long term indicator, and I also look into the difference between them. And uh, as per our data, most of the new cases comes from those municipalities that are already high in terms of their in terms of their COVID cases. So I think it the new surge in COVID cases might affect if the new cases comes from municipalities that are that are previously have low cases, but as of now the current trend is that the new cases comes from the municipalities that already has a high degree of COVID-19, total COVID-19 cases.
Okay, great. And what's your recommendation regarding the policymakers from the models that you have created, from the scenarios that you have exhausted? What would be your like main recommendation to our policymakers?
I think first and foremost, I think for our policymakers, yes, it should be the major cities should be prioritized because since they have higher number of population as well as higher COVID cases, so they are the most at risk for the spread of this disease. But as what we could see, even we should also do not forget those that are uh, municipalities that have lower in their in their priority, because they are also the municipalities that are have lower in their in terms of resources. Therefore care should be policies should be made to ensure that first disease surveillance and prevention should be mainstay in these municipalities, so that we could prevent the entry or further increase of their COVID cases. And also I think it should be it should be what we also need a more visible, transparent prioritization of where these vaccines would be going here in our Philippines, in the Philippines, because sometimes sometimes we see local government units that are not prepared. Suddenly they receive the vaccine right there and then. So I think, and also it would also, with this transparent prioritization, the constituents, the community will be better at ease that okay, these are the priority one, and they won't no longer worry when will we receive our COVID vaccine supply, etc., etc.
I agree. Very much transparency is the key, not only on the side of like the government, but also from the LGUs and even us as communities, as people. We need to make it transparent to the government what we really want. Um, yeah. What else? Let me check the chat from our audience if they have some more questions. Yeah, what's your plan for this project moving forward? I know that you have some background on like public health and even policy, since you have some relevant work with it before. But in terms of moving forward, how do you plan to maximize the things that you have learned for this project, and how you can like make this materialize?
Okay. So, moving forward, first and level one is, firstly, I need to show this to persons in DOH, and also get feedback from them. What are what are their priorities? Because we for me personally, I don't know which indicators that DOH are using at the currently. So maybe we could also use these parameters as well as suggest to DOH other indicators that might be useful in really choosing to prioritize which municipalities to allot their vaccine. So first, dialogue with DOH, and then later on, let's see, because this in general, this kind of methodology is could be used not just for COVID-19 prioritization, but the machine learning algorithm could also be used in other pla- pla- uh, planning activities, such as uh, tomorrow a classmate of mine will be talking about disaster risk identification. So that's another possible case use of this kind of methodology.
Agree. That's my observation to your project and even the first group a while ago, that most of your methodologies are very scalable to even like disaster risk, which is relevant to the Philippines. We have like 20 typhoons and other like natural calamities here. So I think your methodologies would not only be useful for um, the health industry, but also for other industries as well. I do have one last question for you, GR. So based from your research, how do other countries do it in terms of how they prioritize their vaccines? And how do we learn from those methodologies from those countries? And did you implement something similar with your model?
Actually, in terms of vaccine prioritization, WHO was already rolled out their vaccine prioritization, which in fairness to the Department of Health, we also adapted it. So what we are now seeing is in terms of the uh, our vaccine supply, because for example in America, which are hoarding lots and lots of vaccines, they have not they don't have problem in really prioritization because they have enough vaccine compared to us third world countries which have really low vaccine. So this is why we need to really strategize where to where these vaccines could go and what benefits and they are using. And uh, other countries are also using for example other methodologies such as geospatial analysis, so in order to 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 distribute and also to better allocate, and as well as to determine where what sites vaccination sites should be prepared in what areas and such and the such. So I think we could use this different IT solutions in order for us to really provide the needed the needed allocation for our constituents to
All
tailor.
right. Thank you so much, GR. Thank you so much for your answers. I think that's it. That wraps our day three for the capstone presentations. I'm really proud of you guys as our fellows. You've gone through like 2 to 3 weeks creating these projects, and it proved to be really like relevant. I hope that you continue working on those kinds of projects. So to more data projects for social impact and social good. Hashtag makes science and technology serve the people. Again, this has been Bash, your local data activist. Do follow me on LinkedIn, Albert Yumal, and visit my blog at albertumal.github.io. If you're interested to become one of our fellows, coordinate with our Escolabs team. So you also can have like the opportunity to create these amazing projects, and not only because they are like sciencey and like state of the artsy, but they are also relevant to our communities. Thank you so much, guys. See you tomorrow for our last day of the demo days. Bye bye.
Thank you so much, Bash. And thank you, fellows, for your presentations. Here on the screen now, you can see a link which takes you to all the capstone project that all the previous fellows have conducted. And it's a treasure trove of the wisdom of this community and the dedication that they have for Data for Good. So please do check this out. And you can also follow up with the fellows from each project if you're interested in learning more about it from them. And finally, we'd like to share with you our next cohort will be starting on May 10th of this year. And we're offering scholarships like the ones for Data for Good to support fellows who will go on to pursue a career in government or NGO. We'd love for you to now vote for your favorite project from today at this link here.